On this skull, you can see the nuchal crest. It's this highest point of the occipital bone right here. Turn the skull. You can see it there. So that's the highest point on the horse's head, and it's susceptible to fracture in horses that are rearing up in confined spaces. Here's the nuchal crest on an older animal. You can see it right here. Comes up to the highest point of the skull, down right through there. Very pronounced structure. It's an older animal, better developed. The nasal bone is this bone here. Comes all the way down to the tip. So the rostral process of the nasal bone is this piece here that is not supported ventrally by any other bone. So this rostral process is susceptible to fracture by things pushing down on the dorsal aspect of it. And because this nasal bone is not laying right down along our incisive bone here, we have a space in between the two, and this is the nasoincisive notch. And that nasoincisive notch, this caudal-most aspect of it, will be used to approximate the location of our infraorbital foramen in the live animal. The facial crest is this ridge of bone right here. It projects from the zygomatic bone here and the maxillary bone right here. And as we will see later in a dissection, there will be a vein running right here up underneath it that you will tap into to collect small blood samples for hematocrit. Okay, the infraorbital foramen, that is this opening right here. It's the rostral opening of the infraorbital canal through which your infraorbital nerve is passing. And it is located on a line halfway between the nasoincisive notch and the rostral end of the facial crest. Make a line right there between those 2 points. About halfway down that line and about a centimeter or 2 caudal to that, that's where that opening would be, and you can see it lays just slightly caudal to that line between those 2 points. Here is a closer view of our infraorbital foramen. There's the back end of that nasoincisive notch here, front end of our facial crest here, and if you approximate that line between the two, halfway down that line, just caudal to it, there is our foramen. The zygomatic process of the frontal bone is a ventral projection of the frontal bone that joins the zygomatic arch. That is this piece right here. The dog did not have that. The dog had an orbital ligament there joining that frontal bone to the zygomatic arch. So this structure will complete the bony orbit of the eyeball, providing protection 360 degrees around that organ. The supraorbital foramen is located over the orbit in the base of that zygomatic process of the frontal bone. So right as that's coming off, it's located in the base there. And if I tilt this down, you can see that opening right here. The zygomatic arch is a bonic structure extending caudally from the eye, so it starts here and comes out this direction. Now the dog, we talked about this whole piece being an arch, but there was no bony union here, so this is our bony orbit. So in the horse, the arch is just this caudal part of what the dog had. So it extends caudally from the eye, and it is this structure right here. Here's a different look at that zygomatic arch. Here's the highest point here. The mandibular foramen is on the medial side of the ramus of the mandible. So if you look in here, here it is over there, medial side. So its location is approximated by the intersection between two lines. One line will lay here from the lateral commissure of the eyelids down to the angle of the mandible. The other line, a horizontal line through the cheek teeth and that location. So that gives us a point about here. And if I put my finger back here, it's right here. So it gets you close enough to that mandibular foramen using that approximation to stop, begin dropping nerve blocks down there that we'll talk about in a moment. The notch for the facial vessels is an indentation along the ventral aspect of the caudomandibular body, ventral to the last cheek tooth. When we talk about ventral to last cheek tooth, I just see 3 in here, 1, 2, 3. This horse has more teeth that need to be coming in, so there will be some molars back here, farther back. But the notch for the facial vessels will be this point right here. And that's where the facial artery swings from the ventral aspect of this horse head onto the lateral side, and it will lay subacute at that point. And a pulse may be taken from the facial artery at that point there. The mental foramen is an opening on the lateral mandibular body, halfway between the corner incisors and the first cheek tooth. So the corner incisor is going to be right here, first cheek tooth right here, halfway between. There is our mental foramen at that point. The infraorbital nerve is blocked as it exits this foramen on its way to relay sensory information from the nose and the upper lip back toward the brain. Okay, and getting a closer look at that supraorbital foramen. There it sits in the base of that zygomatic process of the frontal bone, and the supraorbital nerve can be blocked at that location, and that will stop sensory innervation from the upper eyelid. Here's a close-up of the mental foramen located there, halfway between our corner incisor and our first cheek tooth. The mental nerves will exit here to supply sensory innervation to the lower lip. So blocking that nerve at that location will block out that sensation. If you want to block out the sensory information from your lower incisors, you would take your needle and you would advance into that foramen. If we take a look at our zygomatic arch here, it arches up and back down. The auriculopalpebral nerve can be blocked as it crosses the highest point of that arch, that point there. So palpate the arch, feel for the highest point of it, and that's where you will drop your nerve block for the auriculopalpebral, and that will block motor function to the upper eyelid. This specimen here is showing the maxillary sinus right here. The bone has been cut away to show that, and we've got our frontal sinus up here. So there is our frontal sinus open from the outside. You'll see that on another video on a specimen that's got all the muscles and connective tissue intact. And if you look down in there, you can see down into the maxillary sinuses farther down. There's my finger coming through right there. So maxillary sinus is down in that area. Frontal sinus is this top spot. Oop, right up there. Maxillary sinus down here. You recall I mentioned it's got a rostral and caudal compartment to it. The caudal compartment is here. There's a divider right here, and the rostral compartment is over that portion right there. So rostral and caudal compartments of the maxillary sinus. This equine skull has been painted so you can see the different bones a little easier. The frontal bone is painted in blue right here. You can actually see our supraorbital foramen there. Frontal bone in blue. Parietal bone is back here in green. Temporal bone in yellow. And our occipital bone is in this pink color here. So the frontal sinus is up underneath this frontal bone in this location here. And you will see that on another specimen with all the soft tissue included. So frontal sinus up underneath that bone there. Now if you compare that to the cow skull, here's our cow skull here. You can see this frontal bone, it starts down here in the calf, but as you know, calves have that little rounded head like a little dog does, but then they get this big blocky head as they grow older. It's Dusty from the lab over here. This frontal bone will start growing in a caudal direction like this, and I see frontal bone. Our nasal bones are missing here. Frontal bone exists from the nasal bone up to the top of that high point of the head, but in the horse over here, here comes my blue, and I see the parietal in green and occipital in pink. Well, where did our parietal and occipital bone go? They were actually pushed over the back of this, and so if you look from behind, there's our parietal bone in green, and there's the occipital bone in pink. So here's a video of those skulls from behind. Parietal bone and occipital bone pushed completely over the back side of that skull. They're still sitting on top here on the horse. Now when the frontal bone starts to elongate and takes the position over the entire dorsal aspect of this skull in the cow, what happens is that frontal sinus that was right up here, like we saw in the dog and the horse, will grow out with that, and it looks like this. So here's the frontal sinus under that frontal bone of a cow. We've got the top of that bone chipped off, and you can see inside there. The brain is housed underneath this shelf of bone right here. The brain is sitting under that. There's a hole in it right there. So there's a big trabecular meshwork in here that supports that, so it's not just one big open cavern that can be caved in if you hit the cow up on top of the head. And coming off of that frontal sinus, there's a corneal diverticulum right here that goes out into that corneal process. So the corneal process is that piece of bone right here that's going to support that horn. So that's the corneal process of the frontal bone, and the corneal diverticulum is a diverticulum off of this frontal sinus into that corneal process. Now some clinicians may call this a corneal sinus. That's okay. That's what they're talking about there. But corneal diverticulum is the proper term, and it will go down into that process at that point. So frontal sinus on this cow. Here's the orbit here from that point all the way back to the back of that head. Now as that corneal process grows, and you can see it's much longer in this specimen than it was in the other, that corneal diverticulum will grow out with it. We look at this horn over here, you can see that diverticulum growing on down into there. And if we come around and take a look at the end of that horn, that diverticulum is all the way out here at the end of it. It won't reach the tip of it. There's a piece missing here off that diverticulum that's gone, but you can, I'm sorry, off the process that's gone. That's why the diverticulum is showing here. So there's a hollow throughout that entire corneal process there. And if we look down into here, that's our frontal sinus down in there, looking through the corneal diverticulum at that frontal sinus. Now we're not going to get down into all the foramina through which the cranial nerves exited in the cow and the horse. You really need to get your hands on those to see them. But what I do want to show you here, because you will hear this one mentioned in your large animal courses. This is a cow skull here. It's a polled animal, meaning it has no horns, so there's no corneal process there. But if we look to the orbit, here's our bony orbit right here. Down at the foramina behind it, I see two openings, one there and one here. The dog and the horse have three openings here. It was the optic canal, and that's the same in the cow. Then there was an orbital fissure and a rostral alar foramen. And if you remember, in that alar canal of the dog, there was a round foramen in there. Well, the cow does not have that alar canal, which means the round foramen would be open to the surface, and there would be no rostral or caudal alar foramina. So there should be a optic canal, orbital fissure, and round foramen. Well, what happens in the cow is that orbital fissure and the round foramen fuse into one structure. So both those openings coalesce into one. And this opening here, just caudal to this optic canal, this large opening here is called the foramen orbito-rotundum. Orbito for orbital fissure, rotundum for round foramen. So foramen orbito-rotundum. And one of the procedures that you will do to remove an eyeball from a cow is to do a nerve block where you're passing a curved needle back behind the eyeball to this point here to block the nerves coming out. And what you're blocking are the sensory nerves coming out from the trigeminal nerve, and that's where that would be blocked at that location there. So you will hear foramen orbito-rotundum at some point in time, I would imagine, and there it is with an old practical exam arrow sitting on it saying identify that opening. So foramen orbito-rotundum in the cow. Okay, here is a cow head that has some rather substantial horns on it. If you look just rostral to that horn here right in the temple, you see a corneal artery right here approaching that from the rostral aspect. Here's the corneal nerve down here coming in from the rostral aspect. Some people will drop blocks in here to block this nerve before dehorning a cow, but whether the nerve is blocked or not, anytime you dehorn a cow, you're going to get a major bleeder out of that corneal artery right there. So there's your corneal artery, corneal nerve in a cow. Okay, here's the skinned horse head. And looking at some of the more superficial structures, one of the first things that you notice here is our facial nerve coming across the masseter muscle here. Both dorsal and ventral branches are here together, and they're dividing out down here into dorsal ventral branches there. Some specimens you'll see two separate pieces coming side by side up here. This one just has them in one. You'll see examples in your dissection guide of each of those patterns in the drawings that they have. So facial nerve, cranial nerve number 7 right there. Here's our parotid salivary gland back here caudal to the masseter muscle. Slide this forward here. Zoom in a bit. Here comes our external jugular vein here, and that was formed by the confluence of our linguofacial vein and our maxillary vein here. They come together there. This is all still parotid salivary gland. In the dog, inside this venous angle, this is where the mandibular salivary gland sat in the dog. A nice little oval structure. But in the horse, the mandibular salivary gland is actually deeper down. It's back here in a long arcing shape. Okay, if I lift up that parotid salivary gland here and look underneath it, there's a mandibular salivary gland down in there. The big long structure right there. A lot deeper than it was in the dog. Okay, there's another area called Viborg's triangle. What that is a triangular shape formed by the caudal border of the mandible. The linguofacial vein as it came across here, this one's not intact. And then the tendon of your sternocephalicus muscle. Here's our sternocephalicus right here. There's a triangular shape right there called Viborg's triangle. This space right in here. When the guttural pouch is distended, it will distend caudally and ventrally into that area, and you can approach it through this triangle here and clean it out, do whatever needs to be done to it without damaging any structures that are important to the horse. So right between this tendon, the angle of the mandible, and then our lingual facial vein that is broken right here. Right there. There is the triangle. Now if we come down here and look just in front of our masseter muscle, there's a triad of structures here. The facial artery is the farthest rostral, the facial vein behind that, and the parotid salivary gland duct is closest to the masseter muscle, the farthest caudal. Those three things come around the front of the masseter muscle in this location. The artery came around from the medial side around that notch for the facial vessels that exists in the mandible. Parotid salivary gland duct was running right through here, where it would have connected up to the parotid salivary gland there. The facial vein comes off the lingual facial vein that was over here feeding into our external jugular. And if I lift this up, the lingual facial will stop here, and there should be the facial coming up and lingual diving down, and I believe that's what we have right there. Let's search for it. There goes the lingual vein down into the tongue there. Facial vein there, lingual facial back here. Lingual vein, that little small one there. That little lymph node right in front of that lingual facial, right in front of the lingual vein, those are our mandibular lymph nodes right there, that little cluster right there. So mandibular lymph nodes are these structures right here. And the angle of the mandible, just like they were in the dog. Okay, I've mentioned here's the masseter muscle here. One of the muscles that closes the mouth. Another muscle closing the mouth is the temporalis, right up here. We will not look for the medial pterygoid muscles on the horse. So the third muscle of mastication that we saw in the dog is the digastricus muscle right here on the back side of the mandible, and that will open the mouth. So there's the one that opens it. Those other two we talked about, masseter and temporalis up here, they will close the mouth. Okay, if we come down here to the lower jaw of this horse, when we were talking about the mental nerve coming off the mental foramen of the mandible, what you will actually do on a live animal is this muscle here is one of the facial muscles of facial expression innervated by the facial nerve. You will actually take that, it's the depressor labii inferioris muscle. You will push it up with your finger like this in the live animal and start palpating for that nerve up underneath it. And if you look right there, there is our mental nerve coming out of the mental foramen at this point here. So there's the mental nerve coming out of the mental foramen right there, and that's where you would block it. Blocking that infraorbital nerve up here, we have elevator labii superioris. Levator nasolabialis is off. It was a thinner muscle laying right over here, and you will push those up and palpate back to feel for that lip of your infraorbital foramen, and right in there is where you find that nerve, and there it is. There's your nerve coming out the infraorbital foramen. It's extremely large. So once again, when you palpate for that, you will put your hands on the skin of the animal, push that muscle up out of the way, and palpate back to locate that foramen. Okay, looking at our horse head again here, if I look up at the base of that zygomatic process of the frontal bone, you can see our supraorbital nerve exiting that supraorbital foramen right there. So there is that nerve where you'd block sensation to the upper eyelid. There's our supraorbital foramen right there. What I want to show you here is a cross section through the nasal cavity of the horse. This is at the front end, as you can tell from the specimen I had in my hand here. This is the nasal septum here. This is the nasal cavity here, divided into left and right halves here. You can see the cartilage of the septum is the light colored structure right down the middle, and of course we've got it covered with the mucosa that you find in the respiratory system. And this specimen is showing you the meatuses and the concha. This mound of tissue here is the dorsal concha. This one here is the ventral concha, left and right sides. Now, the meatus is a space. So the common meatus was a space right here alongside the nasal septum. The ventral nasal meatus is this space where it comes down underneath the ventral concha. The middle nasal meatus is this space here where it comes between the dorsal and ventral concha. And the dorsal nasal meatus is this space at the top above your dorsal nasal concha. This side over here, dorsal, middle, ventral nasal meatus, common nasal meatus, right down against the nasal septum on the midline. And what you notice here is there's a space on either side of these meatuses that we were just discussing. This is the nasal diverticulum. It's a dead end pouch that originates dorsally in the nostril. Now you're not going to be able to see this because these are fixed specimens. There's no mobility to it, but when you put your finger in the nostril of a horse, if you go up dorsally and laterally, your finger will tint the skin up in this direction and you'll be sliding up underneath it and you'll come up to a dead end. Now this one here, I can still see the diverticulum there, so my finger would insert a little bit farther back on this specimen, but it's eventually going to reach a dead end. So nasal diverticulum is sitting up there. It goes nowhere, but what you need to be careful of is when you are inserting a nasogastric tube. Hang on, I'm gonna go get a tube. When you're putting a nasogastric tube in a horse, now they'll be bigger than this. This is just airline hosing for a fish tank. I'm using this so I can get it through this plastinated specimen. What you want to do is, as you insert that tube, you want to keep your finger down on the dorsal aspect of it to keep it in that ventral nasal meatus, so when it passes through, it will be down here in the largest part of this nasal cavity out the ventral nasal meatus. If you don't direct it ventrally, what might happen is it could get up into that nasal diverticulum. I don't know if I can get this up there or not. There we go. Up the nasal diverticulum right there. That's going to end up coming to a dead end and stopping right here, and you're not going to get anywhere. But if you're up there, you'd be able to see this tinting up or pushing this skin laterally right here, and you could see it creeping up under this right there, so you'd know you're in that spot, and definitely when you hit the back end of it. So you don't want to be in the nasal diverticulum, come out, run that thing ventrally, keep it down ventral, and have it come out through a nasal cavity right there. So nasal diverticulum, one on either side, just a dead end dorsal pouch off that nasal cavity. Here's another specimen. Same thing. And there it is on a cross section right there. Okay, this video deals with the guttural pouch of the horse. And what the guttural pouch is, it is a caudo-ventral expansion of the auditory tube, that tube that connects the middle ear to the nasopharynx. And it's a big pocket, mucous membrane lined, and because it's open into the nasopharynx, which is open through the nasal cavity to the external environment, things can be inhaled and get back in there and cause problems. Fungal infections, bacterial infections. And so oftentimes you're called upon to treat those conditions. So this guttural pouch is a very large sac-like structure. There's one on each auditory tube, and it will sit between the pharynx and the base of the skull and the atlas. So it's right there at the back of the head. And this specimen here is showing this is the epiglottis here, retinoid cartilage is up here. So this is the beginning of the pharynx, laryngopharynx in the horse. Little hyopharyngeus, thiopharyngeus, cricopharyngeus muscles are here. Don't worry about those. Thyroid's here, and trachea is coming on down right there. So this is the pharyngeal, the pharynx here. So between the pharynx and the base of the skull that would be higher, that's where the stylohyoid bone's articulating. That is where the guttural pouch is located, right in here. And it's actually got medial and lateral compartments because this pouch, this little sac, will actually sag over each side of your stylohyoid bone to put a medial compartment here and a lateral compartment over here. So the stylohyoid bone right here will divide that into the two compartments. Okay, I want to show you the hyoid apparatus in the horse. Here it is. Here's your large stylohyoid bone right there, involved with the guttural pouch. And just as, I guess, a novelty, coffee table talk, the basohyoid bone that runs side to side right here, in the horse it has a lingual process right here that runs up into the tongue. So if you see a radiograph of a horse head, which I'm sure you will at some point in your life, you large animal practitioners, you're going to see a piece of bone projecting forward off of that and into the tongue, and that is a normal structure. But this is your stylohyoid bone, a little easier to see than right here. The rest of those bones are buried in this specimen. Okay, here's our horse head cut on cross section right there. Here's the guttural pouch. The guttural pouch has a medial and lateral component, and you can see that bone right in the middle, the stylohyoid bone, separating those two components right there. So there's a stylohyoid bone, medial compartments here, lateral compartments over there. Now what you find in the caudal aspect of this medial compartment of the guttural pouch is cranial nerves 9, 10, and 11, and the internal carotid artery bulging down into it. So any fungal or bacterial infections that are occurring in this region, in this structure, can erode through that mucosal lining and get into those structures there, causing difficulty swallowing with a glossopharyngeal, eroding through the wall of the internal carotid artery, causing bleeding problems. So I'm going to pull this longest collar muscle out right here, and I'll show you those here on the back side of that medial compartment, that guttural pouch. You can now see the glossopharyngeal nerve right here. Part of the tongue and the part of the pharynx right there comes glossopharyngeal, sagging into that guttural pouch, and you can see how having a bacterial or fungal infection around that structure could create problems for that nerve. And now what you can see in this view, our glossopharyngeal was back down there. If I pull here, this is the vagosympathetic trunk, and you can now see, so sympathetic component, vagal component, vagus nerve, and here's our internal carotid artery right here behind both of those. The accessory nerve is farther up. It's not that important as far as being affected by guttural pouch problems because it's going to the trapezius and some other muscles in the neck. Other thing of note here in this pharyngeal region, here's the area of our pharynx down in here, or larynx. Here are medial retropharyngeal lymph nodes, and infections in those can rupture into this pouch as well. So when this pouch distends and it needs to be cleaned out, you can either approach it via endoscopy through that opening of the auditory tube in the nasopharynx, or when this distends back into that Viborg's triangle, you can approach it surgically when it distends back into that area.